Hey there, Dr. Lisa Faast here, and I want to talk to you guys today about flu shots. Now, you might be thinking, hey, flu shots is kind of far away, but now is the perfect time to be strategizing for flu shots and other vaccinations. Many pharmacies that I've talked to, especially since the Pharmacy Profit Summit, when we talked about long-term care at home, have been focusing on long-term care prescriptions. Now, I'm talking about facilities like nursing homes. And the reason that pharmacies want to do more of those is those prescriptions tend to be far more profitable than your typical retail prescription. You pay less for your drugs, you get paid more for the drugs, and you don't have DIR fees. So it's a win-win-win situation for pharmacies. However, many local independent pharmacy owners find it hard to kind of break into the nursing homes. Many of them have long-term contracts with maybe some nationwide pharmacies, and they find it hard to kind of get their foot in the door. Vaccines and flu shots in particular can be a fantastic way to get your foot in the door and at least get some business from that nursing home, and maybe even potentially the possibility to kind of usurp that other pharmacy and become that nursing home's pharmacy. So how do you do this? How do you leverage vaccines? So if that nursing home has a pharmacy contract where maybe that pharmacy isn't local, maybe it's one of the nationwides, maybe they just have a fulfillment center nearby to fulfill the medications, they don't really have boots on the ground. That is where you can show how you're different. You can offer to do vaccines in person for everyone. Now, sometimes those pharmacies, they'll just ship the vaccines for them, and then the nurses have to go around and do all the shots. And that takes a lot of time, and they don't like doing that. They don't like spending their time on that. They, of course, will. It's good for patients, but they have lots of other things to be doing. So what you can do is, if you have a nursing home in your community, you know that they're using kind of a big name pharmacy to fulfill all the prescriptions, it's really good to reach out to them and to say, hey, I can come do your vaccines for you. I can do your flu shots for you. And how do you get in touch with them? How do you get in front of them? If you just show up unannounced, chances are you're not going to get past, the front receptionist, much less talk to like the nurse admin. So generally you're wanting to talk to like a manager, a nurse manager, something like that in order to be able to talk to them about vaccines. So there's a couple of things that I recommend doing. And it's not, unfortunately, there's not just one magic bullet. And usually you're going to have to try multiple times, but getting into these homes can be very valuable in the long term. So you got to think long term. One is a little bit of cold calling. You're calling, you're asking, who's the right person. If you don't know the names, you're asking questions, you're asking to leave messages, and you're kind of just being that greasy wheel that you hope gets the attention whenever you're calling and doing those kind of cold calls. Another thing is cold emails. When you do cold emails, you always want to make sure that you let them know that you're local. You say, hey, this is Lisa from Diversify Pharmacy down the street. I'm a mile away from you. I'd love to be able to provide vaccines and do the injections myself. Like, kind of use some common name because they're local, they're there, and you want to make sure that you're kind of bringing up that local differentiator. Hey, I'm a fellow, ABC city resident, and I would love to help you help your patients. Those kinds of things. So in email, it's really important that you almost get personal. You get a little intimate in the sense that you want them to know that you're local and why you're reaching out to them. Postcards can actually be really good. Postcards and enveloped mail as well. Postcards are a lot cheaper, but usually you're not mailing out many of these. So you can do full-on envelopes and letters. Mail gets opened at those kinds of places, but postcards are really good because you can get a message out without them having to open anything. So, we do vaccines for you, in really big, bold letters on like an oversized postcard is probably going to get read more likely than not. And so the next thing is to visit in person. And now I would visit in person kind of after you've done those things, or after you have some sort of maybe a little bit of a toe in the door. Then I would visit and I would say, hey, I'm following up to my phone call, or I'm following up to the email I sent, or I'm following up to the postcards I've sent. And there implies a little bit of a relationship there, when you're following up in person. Faxing is still really great. I know. Faxing, it's 1980, but in pharmacy and in healthcare, faxing is still very much a thing. So fax them. Don't mass fax. You can't, bulk fax, but individually fax them. Let them know that you're local. Let them know that you're taking reservations for flu shots. You can add on extra vaccines to any other patients that need it. You can do a full review, see what the patient might need. You can really handle that service. And you might get ignored. That's okay. It's always worth trying. Try again next year. But chances are you're going to get some sort of response. And that response, even if it's a no, sometimes you can find out valuable information from that no. It might be no, our pharmacy, ABC is doing vaccines. And then it's like, great. Are they actually sending someone to do it for you? Or are they just sending vials or pre-filled syringes of the vaccines? Like, it's always okay to talk with somebody, even if they're telling no, because it's a good chance to find out more information. Maybe you didn't know that Nationwide Pharmacy, started doing vaccines, or maybe they were contracted with somebody else locally. Like, it's always good when you get to talk to somebody, and you always get the chance to kind of put your best foot forward whenever you're talking with somebody. So even if somebody is gonna say no, still take that call and still chat with them. At least the right person to start building that relationship with. Visit them monthly, ask how it's going, ask if they still love their pharmacy. Like, be that welcome pest, so to speak, of being there and with them, and at least who you're talking to, and it's the right person. So cycle through these. Don't just send one email and be like, oh, I didn't get calls. That's it. It didn't work. It's going to take multiple times. Send a postcard, do a phone call saying, hey, I'm following up with the postcard I sent. Then do an email saying, hey, I'm emailing and following up about the postcard or about the phone call that I did. Like, it is a round robin, and you keep going and you'll figure it out. You'll be a little clumsy at first. That's okay. No problem. You will always get better the more times you do this. And so eventually, and then you might get a yes. That's the goal, obviously. You might get a yes. You might get a yes to do the vaccines. And then you might get a yes like, you're really awesome. I wonder if you could do all of our prescriptions. Like, that definitely happens. That is how I got into a ton of residential care facilities. It's how I got into some nursing homes. It's actually how I got into a lot of surgery centers, is just by doing one little thing and getting to do that one little thing and doing it really well. Then they kind of invite you to do other things. And so if you're looking to get into nursing homes, vaccines can be a great time to do that. So start strategizing now, start creating your postcards now. If you're a Pharmacy Badass University member, don't forget, we can help you create all those graphic designs. You all get free unlimited graphic design as a member. So just let us know what you're trying to do, and we can help create that for you. But the time to start doing that is now, before it's flu season, before they've already agreed to go with somebody else, and be that first one in the door. And even if you're not successful this year, don't worry, keep at it. You can try it again next year, or just build that relationship up. Offer to be that emergency pharmacy, offer to be just that support system. If something happens, there's always delivery delays, there's weather events, there's all kinds of things. Just offer to be that backup. And that, again, that can just get your pinky toe in the door. That might lead to bigger things. So I hope you enjoy this. Feel free to comment or post any questions down below. Share it with a friend. Out here to try to help as many independent pharmacy owners as I can, and I'll talk to you next time. Bye-bye.